Welcome back. With the school year well underway here in the Bronx, many families are already struggling to balance work, home, and school. This can take a toll on mental health, especially for children. One local program, Promise Zone, is working to turn the tide and help children and families get the mental health support they need to stay healthy inside and out. Here now is VNS Health Behavioral Health Supervisor, Keshia Lewis. Keshia, thank you so much for joining me.
Good morning. Thank you for having me.
Now, can you give us a little bit of an overview about Promise Zone and how it supports children and families in the Bronx?
Okay, so Parma Zone is a program that's near and dear to my heart. We currently are in 9 schools in the Bronx that covers 3 school districts, which are districts 8, 11, and 12. So the whole purpose of our program is to provide support in the schools, working on crisis behaviors, providing social emotional supports for the students and families that we service.
Now, what motivated the creation of the Promise Zone, and how has its focus evolved over the years?
Okay, so approximately 12 years ago, OMH started the initiative. It's provided all throughout New York State, but VNS Health is the only agency that currently does the work now and has the contracts in the Bronx. The whole purpose of the program was to support schools, kind of like work on improving in attendance, but also limit calls to EMS and having EMS activated for students who are currently in crisis.
Now, can you explain what that means to be currently in crisis?
So sometimes when working with our young people, they could be challenges at home, and we might see certain behaviors where they might be like with a little bit withdrawn. You might see some type of suicidal ideations. They might become like a little aggressive and a little violent, and that might warrant a 911 call. We do understand that having EMS activated can be something that's very traumatic to our young people. So the whole purpose of our program is to be in the school trying to kind of like do the work. Once we start to see the behaviors, kind of work with the young people to kind of de-escalate the behaviors, support teachers and kind of like doing the work to kind of know the warning signs, as well as supporting parents when they realize that their children are having difficulties.
Now, I think this is amazing because I think oftentimes when we are talking about younger people, teenagers and children, we often think of punishment, or if they're acting out, that this is something that needs to be corrected in a different way. And I like that this kind of focuses on just another way to address the situation. With that being said, what specific signs should parents and teachers look out for that might indicate a child needs emotional and psychological support, as opposed to just, thinking that they should be punished or, dealt with in another way?
I think a lot of times listening to how our young people kind of show up, how our youth show up, sometimes they can isolate themselves and kind of not want to talk to people necessarily, like if they're being combative, or people like to use the word defiance. It doesn't necessarily mean that they don't want to listen to you. It can be like other things that are kind of going on, and they necessarily don't have the skill sets to kind of like verbalize their emotions and exactly what they need. Also, too, being aware of student situations. A lot of times we have families that can be homeless, they can have housing security, families might not have a lot of needs, they can be migrating from like different cultures. So also kind of like being aware of like all the background and everything that's going on with the students. Just because a student is absent, it might be like other reasons why it's absent. It might be like caregiver can't bring them to school, a family member might be sick. So just kind of like opening up your eyes and really paying attention.
Now, how does Promise Zone provide support not only for children but also for their parents and families?
Okay, so I think VNS did like a really amazing job. Maybe I'm like a little bit biased. So how we do that for parents is that we have social workers who work with our children, but we also have family advocates that support our parents. A lot of times it's kind of like hard to ask for help. We have families that have been in a variety of systems, right? So they may be like a little bit stigmatized of kind of like asking for help. So our family advocates really do great, amazing work working with our parents. It can be workshops around finding employment, applying for benefits, getting housing, how to manage like your own wellness. They're also kind of like the champion in giving a parent a voice, helping them have their voice, being able to advocate, not only for their children, but also for themselves.
And what advice would you give, to a parent or a family member who may be feeling overwhelmed?
I think it's important to ask for help when you need it, like kind of like use your village. A lot of these schools have some resources, so kind of like tapping into like the resources. I think it's also being aware if you're not good, you can't really show up for your children, how you need them to show up. And our children kind of like really realize as adults kind of like when we're struggling.
Now, I think this is probably the most important part because children are at school, for most of the day. What role do teachers play in identifying students who may need help?
I think teachers are the first line of defense, because generally kids are in school 8 hours a day, and that's like when you really build like the relationship and kind of like the rapport. So I think having those check-ins with your students, I know it's kind of like hard, but incorporating some type of social emotional learning aspect in your daily routine, that's a way to kind of realize where there's some challenge, and then that's how you can know how to seek help.
And how does Promise Zone collaborate with teachers?
So we collaborate with teachers in multiple ways. Sometimes we might do like workshops, helping a teacher kind of like identify how to look from a trauma-informed lens, how to realize a child is in crisis. But also we know that the work that the teachers are doing is very rewarding work, but it can be like very taxing. So my staff as well as myself, we do workshops with our teachers on wellness itself. Because being a teacher and showing up in a classroom, you have to have emotional intelligence as well. And you have to understand like when you're not well emotionally or you need someone to kind of like step into you. So how to recognize those signs, how to avoid burnout. That's some of the support that we provide teachers. And also providing psychoeducation on around things like different mental health diagnoses around autism or ADHD. Sometimes you kind of have to like simplify the work that we're doing, but we might necessarily not have the experience in doing that. So we can have group workshop for teachers, but one thing that my staff is really amazing is doing like individual like check-ins. So whenever teachers are having challenges with students, they're always able to come to us and ask us like questions, and we're able to provide them some feedback and support.
And why, may a program be like that, essential in a place like the Bronx?
I think in the world that we live in, we have people that come from a variety of backgrounds. It provides work that is individualized to like the schools themselves. Different schools have different cultures. Being kind of like mindful of that when we're looking at the different schools, there's different topics or different needs, and our program is really good at providing those individual supports. Also too, just working it together like as a community to try to like tap in and provide the supports that needs. I know a lot of times mental health is like very well stigmatized. There's nothing wrong to talk to someone kind of like when you need help. I always say like I wear glasses. So I use glasses to kind of like help my vision. So it's the same way by having a social worker or a family advocate to kind of like speak to. It kind of helps you get the things that you need better in life and feel the support.
Now, how can community members advocate for the expansion of Promise Zone to more schools across the Bronx and New York City?
So if it was up to me, I would say Promise Zone will be everywhere. So we last received funding 12 years ago, and it's never been an increase in the funding. I feel that you have to speak to your local council people so they could put more money into services like this so we can be across New York City.
Well, Keshia, thank you so much for joining us and having this conversation.
Okay, thank you.
For more information, you can visit the website at vnshealth.org. So, anywhere, we'll be back with more Open right after this.